What I tell patients is really important is we put the compression garment on immediately after surgery, and I tell them to continue to wear that because that really helps with postoperative swelling. And then within a week after surgery, we usually start postoperative massages in our office where I also see the patient. And that again helps really speed up the healing process and decrease the amount of fluid and swelling that builds up underneath. Sometimes patients will put on the compression garment and they'll get home and they may feel uncomfortable or they just don't like it, so they'll take the compression garment off. They won't follow postoperative instructions for postoperative massages. That's not ideal, but it's not going to ruin your surgery, but what it does is it really slows down the healing process. So they'll have more fluid accumulation where we perform the liposuction, and sometimes that fluid can build up and will need to be drained in the office. Also, it kind of helps promote healing. If they don't wear the compression garment, what that also does is it really increases the amount of time that their swelling will be present for. They'll be greatly improved within the first couple weeks of surgery, and patients will typically do very well. So recently I had a patient who underwent liposuction surgery. The patient was a female in her 40s. And her recovery went pretty great. Yeah, the first couple of days she was sore, had some discomfort that was controlled with medications, but that was expected. She continued to wear her compression garment and she began her postoperative massages at about a week after surgery. But after a week, she said she felt much better. She was able to do things around the house. She felt like she could go back to work. These are really kind of the expected outcomes that most patients experience after liposuction surgery. After performing liposuction, what's included in part of the surgical process is patients are going to wake up with a compression garment that we provide. They're going to see me after surgery many times, included in the process, and I always love to see my patients through the healing process. Patients also get postoperative massages performed at our practice. That's included as well. So it really kind of helps take off some of the anxiety or stress, some of the burden off the patient for thinking, where am I going to find the garment, or where am I going to get a massage? Will I even see the surgeon after surgery? All those are included. Take that very seriously as well.